dressing to the body. Keep dressings dry and clean, and change the dressing daily or more often if it gets wet or gets dirty. What are the purpose of dressings and bandages since we use them for or in controlling bleeding? The purpose of dressing is to control bleeding, to prevent infection and contamination. Fluid wear gloves if possible. Nowadays, of course, it's always possible, and it is possible. Use a dressing large enough to extend beyond the wound edges, and cover the dressing with bandages. Let's go now to bandaging. Bandages have three key uses: apply pressure to bleeding wounds, covering wounds and burns, providing support and immobilization for broken bones, sprains, and strains. There are different types of bandages. This is the triangular bandage. You have the elastic bandage, and of course the tubular bandage, which is also made up of gauze. So these are the different types of bandaging techniques. First is the elbow bandaging. You may use a cravat for elbow bandaging or the triangular bandage. No, bend arm at the elbow and place the center of the cravat at point of elbow. Bring ends up and across each other in overlapping spiral turns. Continue one end of the arm and the other end down the forearm. Bring ends to front of the elbow. We will be showing you a video presentation in different types of bandaging techniques. And then for the arm bandaging, for arm bandaging, we may also use the triangular bandage or the cravat. In using triangular bandage, place the hand in the middle of the bandage with the wrist at the base. Place apex over the fingers and tuck any excess material into the pleat on each side of the hand. Cross the ends on top of the hand, take them around the wrist and tie them with a square knot. We will also be showing you in the video how to make a square knot and how to make sure that you are making the right square knot. For palm bandaging, that is using another cravat, of course. For the palm bandaging, place the center of the cravat over the dressing. Bring ends up and across each other in overlapping spiral turns. Continue one end up the arm and the other end down the forearm. And bring ends to the front of palm and tie. Next is leg bandaging. Place center of the cravat over the dressing. Begin ascending turns with upper end and descending turns with the lower end, with each turn covering two-thirds of previous turn until the entire dressing is covered. And by tying the ends with a square knot. Next is knee bandaging. For knee bandaging, that is cravat for the knee, start up on top of the knee, cross over and twist 2 to 3 times under the knee, and cross over on top. Pull ends to opposite sides. Secure the square knot under the knee. All of these types of bandaging will be shown in the video later on. In bandaging a foot, it's the same procedure discussed earlier using triangular bandage with the hand. No, it is using triangular bandage. Place the foot in the middle of the bandage. Place apex over the toes and tuck any excess material into the pleats on each side of the foot. Cross the ends on top of the foot and take them around the ankle and tie them with a square knot. And then this is head bandaging, which will be demonstrated in a while. And also we have side of the temple bandaging. These are injuries at the temple area or the ears. So we will be showing you now the video presentation of the different bandaging techniques. Our next first aid video is about bandaging. Bandages have 3 key uses: applying pressure to bleeding wounds, covering wounds and burns, and providing support and immobilization for broken bones, sprains, and strains. We secure a bandage using a square knot. A square knot is an ancient and simple binding knot used to secure a rope or line around an object. The knot is formed by tying a right-handed overhand knot and a left-handed overhand knot. To make sure that you made a right square knot, pull one end of the bandage. For this next video, we will show you the head tap bandage. This is used for head injuries. Fold the base at least 2 to 3 inches. Place folded base aligned with the eyebrows. Pull back and cross over at the back, tucking apex beneath. Pull both ends in front, secure with a square knot at the center of the folded base, and tuck ends. Pull down apex and tuck sides deeply. Tuck apex neatly at crossover area. I'll show you how to bandage. Place the hand in the middle of the triangular bandage with the wrist at the base of the triangular bandage. Place the apex over the fingers and tuck any excess material into the pleats on the other side of the hand. Cross the ends on top of the hand, take them around the wrist, and tie them with a square knot. We will now show you how to make an arm sling. Place folded base directly or vertically over one arm, with pointed directly under the elbow of the injured arm. Lower ends of the base at the side of the neck using a square knot. Make several twists with the apex and tie a knot. You may now tie the knot. We will now show you how to make an underarm sling. Arm sling, exactly. Secure end of the base. Triangle the size of the injured individual. Place the apex at the shoulder of the injured part. Pull back folded base and secure with a square knot at the center indentation at the back. We will now show you how to make a cravat bandage. Pull the apex to the base of the triangular bandage. Pull both ends together until you form a cravat. Cravat bandage for the forehead. Place the center of the cravat over the compress, covering the wound. Carry the ends around to the opposite side of the head, cross them, and bring them back to the starting point and tie them. Cravat bandage for elbow. Bend arm at elbow and place center of cravat at the point of the elbow. Bring ends up and across each other in overlapping spiral turns. Continue one end of arm and the other end down the forearm. And bring ends to front of elbow and thigh. Cravat bandage for the knee. Start on top of the knee. Cross over and twist under the knee. Cross over on top and pull ends to the opposite sides. And secure a square knot under the knee. Cravat for forearm injury. Place center of cravat over the dressing or over the injured part. Begin ascending turns with upper end and descending turns with the lower end, with each turn covering 2/3 of preceding turn until dressing is covered. Shoulder armpit cravat. For this type of bandage, we tie 2 triangular bandage together to form 2 cravats. Start at the armpit. Cross over at the injured shoulder. Armpit. Side of front. Shoulder armpit cravat. Cravat bandage for the cheek or ears. Use the white cravat. Start with the middle of the cravat over the compress, covering the cheek or the ear. Carry one end over the top of the head and other under the chin. Cross the ends at the opposite side. Bring the short end back around the forehead and the long end around the back of the head. Tie them down over the compress. Cravat bandage for the cheek. Cravat bandage for the eye. Lay center of the first cravat over the top with the front end falling over uninjured eye. Bring second cravat around the head, over the eyes, and over loose ends of the first cravat and tie in front. Bring ends of the first cravat back over the top of the head. Tying there and pulling second cravat up and away from the uninjured eye. So rough bandage for the eye. Next on our medical emergencies, we have shock. Shock refers to the circulatory system failure that happens when insufficient amounts of oxygenated blood is provided for every body part. This can be a result of loss of blood due to uncontrolled bleeding or other circulatory system problem, loss of fluid due to dehydration or excessive sweating, trauma or injury, and occurrence of an extreme emotional event. So, what do you look for in managing a shock? No, altered mental status, like there's anxiety, restlessness, you have clammy skin, nausea and vomiting, then shock is severe. A person in shock may appear stunned or confused. So, in managing a person, cover the victim to keep him or her warm to prevent body heat loss. Blanket and coat under and over the victim. If with vomiting, place the head in lateral position or allow the vomiting and prevent aspiration. And then one type of shock is anaphylactic shock. No, anaphylactic shock reaction to insect bites, medicines, or certain foods. Symptoms include hives, overall weakness, and swelling of the throat. Ask if the person has medication. If so, give it to him or to her right away. People with severe allergies also usually wear a mag. It is a bracelet or ID that contains information such as name of the patient, medication, contact for that possible information. Anaphylactic shock can be deadly, so call for help fast and be prepared to start CPR. Stings. And insect bites. What do you do with this insect stings and insect bites? First is ask the victim if he or she has had a reaction before, and then wash the sting site with soap and water to prevent infection. Apply an ice over the sting site to slow absorption of the venom and relieve pain. Because bee venom is acidic, a paste made of baking soda and water can actually help, and seek medical attention if necessary. Heart attack. Signs that someone is having a heart attack include shortness of breath or difficulty breathing, anxiety, pressure, squeezing, fullness or pain in the center of the chest, radiation down either arm or in the jaw, ashen color to skin, and perspiration. There's also nausea and vomiting. First aid for heart attack begins with calling 911. Okay, and then make the victim comfortable either lying down or sitting. Loosen tight clothing at the waist and neck. Ask the victim if he or she has a heart medication. Don't let the victim move around. And finally, give the person any stimulants like coffee or tea. If the heart stops beating, begin CPR. Okay, don't give stimulants like coffee or tea. Just keep him or her comfortable until EMS personnel arrives. Next, in our medical emergencies is choking. We will also be presenting to you a video. But of course, choking is an obstruction in the airway. The general precautions in choking is that if someone is coughing, leave the person alone. Do not perform the Heimlich maneuver. No, you keep the eyes on that person. Ask the person if he or she needs help. And then, what are the signs of choking? Person is not able to breathe or talk due to obstruction. Choking sign given like distress and panic. Hands wrapped around the neck is a universal sign of choking. So ask a person to speak or cough, deliver 5 back blows, perform abdominal thrust, repeat sequence of back blows and abdominal thrust. If the person can cough or talk or he or she is not choking, keep eyes to that person. But if the person can't talk or cough, first deliver 5 back blows between person's shoulder blades with the heel of your hand. No, this is the heel of your hand. If the back blows don't clear the object from the throat, perform abdominal thrust. Stand behind the victim and wrap your arms around the waist. Make a fist with one hand. Place your fist thumb side in against the victim's stomach, above the navel but below the ribs. Grab your fist with your other hand. You have to pull in. An inverted J is actually made sharply and repeat if necessary to dislodge whatever is stuck in the throat. You have to repeat the sequence 5 back blows, 5 abdominal thrusts until the object is cleared. If abdominal thrust does not work, you have to call 911, perform finger sweep, abdominal thrust, check for CAB. I'm sorry, that's CAB. Perform CPR if not breathing. To an unconscious victim, ask someone to call 911 for help. Lower the victim to the floor or back or left side and perform the Heimlich. Open airway with a tongue jaw lift maneuver. Look inside the mouth if you cannot see anything. Do not do finger sweep. Try to give 2 full breath or rescue breaths, and if these do not go in, um, reposition the head and give another breath. Perform abdominal thrust, continue until successful or help arrives. We will now show you a video on how to perform Heimlich maneuver in choking. Maneuver to relieve choking in a responsive adult or child. Do not use abdominal thrust to relieve choking in an infant. Stand or kneel behind the victim and wrap your arms around the victim's waist. Make a fist with one hand. Place the thumb side of your fist against the victim's abdomen in the midline, slightly above the navel and well below the breastbone. Grasp your fist with your other hand and press your fist into the victim's abdomen with a quick, forceful upward thrust. Repeat thrust until the object is expelled from the airway or the victim becomes unresponsive. Give each new thrust with a separate distinct movement to relieve the obstruction. Heimlich for pregnant and obese victims. If the victim is pregnant or obese, perform chest thrust instead of abdominal thrust. Stand or kneel behind the victim and wrap your arms along the victim's chest. Make a fist with one hand. Place the thumb side of your fist against the victim's chest. Grasp your fist with your other hand and press your fist into the victim's chest with a quick, forceful upward thrust. Repeat thrust until the object is expelled from the airway of the victim becomes responsive. Give each new thrust with a separate distinct movement to relieve the obstruction. Choking relief in infants. Use back slaps and chest thrust for choking relief in an infant. Do not use abdominal thrust. Follow these steps to relieve choking in a responsive infant. First, kneel or sit with the infant in your lap. If it is easy to do, remove clothing from the infant's chest. Hold the infant face down with the head slightly lower than the chest, resting on your forearm. Support the infant's head and jaw with your hand. Take care to avoid compressing the soft tissue of the infant's throat. Rest your arm on your lap or thigh to support the infant. Deliver up to 5 back slaps forcefully between the infant's shoulder blades using the heel of your hand. Deliver each slap with sufficient force to attempt to dislodge the foreign body. After, place your free hand with the palm of your hand. The infant will be adequately cradled between your 2 forearms with the palm of one hand supporting the face and jaw, while the palm of the other hand supports the back of the infant's head. Turn the infant as a unit while carefully supporting the head and neck. Hold the infant face up with your forearm resting on your thigh. Keep the infant's head lower than the trunk. Provide up to 5 quick downward chest thrusts in the middle of the chest.
Over the lower half of the breastbone, deliver chest thrusts at a rate of about 1 per second, each with the intention of creating enough force to dislodge the foreign body. Repeat the sequence after 5 back slaps and up to 5 chest thrusts until the object is removed or the infant becomes unresponsive.
Next, in our medical emergencies, you have electrical shock. Of course, in electrical shock, the first rule of dealing with electrical shock is not to touch a person who is in contact with the live electrical current. Okay? If you do, the current can pass right through that person to you and cause the same injury. So the first thing you should do is to turn off the power to the electrical equipment involved and then call for 911. Electrical shocks can be life threatening. You want to get EMS personnel on the scene quickly in case the victim has stopped breathing. If you have to remove a person from a live wire, be very careful so you do not get a shock or you do not get a shock too. You know, stand on something that's an insulator like a rubber mat, wear rubber gloves, and use a dry stick. A wooden broom handle or a board to push the person away from the wire. Don't use anything metal or anything wet or anything damp. Once the victim is safe, check for breathing. Begin with CPR if the person if not is not breathing. Next is eye injuries. For eye injuries, these are common workplace medical emergency, especially if you have sharps or you are working with a lot of metals, you know, sharp materials. Eye injuries are common workplace medical emergency. Eye protection can prevent most injuries. In case, you should be familiar with first aid for different kinds of eye deep tissue damage. You may even see exposed bones. For third-degree burns, call 911 immediately and keep the victim comfortable until help arrives. You always have to get immediate medical attention for all burns, especially those that are severe and that cover large areas of the body. Next, we have heat exhaustion. Working in a hot environment or in a hot day can be very stressful for your body, especially if you're not used to the heat. Heat exhaustion may start out as discomfort and fatigue, but can quickly develop into something more serious. Symptoms of heat exhaustion includes pale or flushed appearance, weakness, heavy sweating, headache, moist and clammy skin, dizziness, and sometimes nausea or slight fever. First aid for heat exhaustion involves these steps. First is you move the client or victim to a cool place. You have to lay the victim down and elevate 8 to 10 um, inches or elevate the feet 8 to 10 inches. Loosen the clothing, give the victim water and encourage him or her to drink slowly and apply cool compress to the head and body. And also, do not administer salt tablets, as uh, these are blood pressure risk. If a person is suffering from heat exhaustion, it is and not treated properly, it can turn into heat stroke. Heat stroke is a life-threatening condition in which the body gets so hot that it can't cool down. Signs of heat stroke include very hot and dry skin, extreme tiredness, and confusion. You have to act fast in cases of heat stroke, so you have to call 911 immediately. While you're waiting to help for help to arrive, cool the person down by hosing his head or her body with a cool water or by fanning the body. Monitor the victim to make sure the air remains open, the person is breathing, and the person has pulse. If you work on environment or if you exercise or work outdoors on hot days, you should recognize the symptoms of heat stroke and take precautions to prevent overheating. So what are these precautions? You have to take a lot of fluid and then face yourself down while working, and then you take rest breaks in a cool place and so on. Next, we have fainting, another medical emergency common in the workplace and in the school. Fainting can occur from blood pools in the legs, reducing the blood flow to the brain. There is a sudden fall and supply of blood to their brain that results in people when standing prime in the heat. Fainting can be brought on by stress, for breathing. And if the person is not breathing, emergencies on our list is the epileptic seizure. No, a person having an epileptic seizure may fall to the ground and have convulsions. If a person appears to be having seizure, remove the victim from any dangerous object or hazardous situations. You have to clear the area when the victim eventually falls or where the victim eventually falls. No, this is because a priority for epileptic patients is safety. Remove victim from any dangerous object or hazardous situations. Check for breathing. Don't put anything in the victim's mouth. Try to keep the victim as comfortable as possible and call for emergency and medical assistance if the seizure lasts more than 5 minutes without signs of slowing down. If the person has trouble breathing afterwards, or if the person is in pain or other injury is present. Remember to put nothing in the mouth and call 911 if medical assistance is needed. Sure, what are the key points to remember in you remember emergencies can happen anytime, anywhere, to anybody, no? And then you have to act quickly, calmly, and
Okay, so thank you, Salinahi Drans Troop, for the wonderful performance. At this juncture, we are now on the second part of our webinar, which is the basic life support discussion and demonstration. Please allow me to introduce to you our next guest of honor and speaker. This task of introducing our second guest of honor and speaker is a great privilege. It one takes a closer look at the alchemy of the achieving person. Two distinct virtues pop up, besides perseverance and hard work. These are pioneering spirit and willingness. Our guest of honor and speaker today is living idiom of man who happened to be born at the right time and at the right place. Please allow me to mention his background in the field of nursing. He finished his Bachelor of Science in Nursing from Jose Feliciano College in 2007. Currently, he is a candidate for the Master of Arts in Nursing major in Nursing Administration at the Our Lady of Fatima University Graduate School. He started his career as an emergency room nurse at the St. Catherine Alexandria Medical Center in 2007, faculty member of the College of Nursing at the Jose C. Feliciano College from 2008 to 2011, and Learning and Development Insurance Coordinator, New Medical Center in Abu Dhabi, United Arab Emirates from 2014 2017. At present, he is the school nurse, occupational health and safety nurse, and a faculty member at Systems Plus College Foundation, teaching fundamentals of nursing, health assessment, community health nursing, related learning experiences, ethics, among others, and currently molding the nursing students to become caring and compassionate nurses. He is a member of Occupational Health Nurses Association of the Philippines, a certified basic occupational safety and health or BOSH, a certified basic life support provider, and a certified Philippine Red Cross first aider. With great honor and pride, please help me to welcome our second guest of honor and speaker, Professor Marco Ryan H. Batak.
Hi, good morning, everyone. Thank you for that warm welcome, Dr. Orte. And I want to welcome you to this webinar series. And for all the participants, I hope you are all in great health and keep safe, everyone. And I just want to thank the College of Nursing, the Systems Plus College Foundation, for giving me the opportunity to share whatever knowledge that I have. And I am also honored to be the speaker for almost 1,000 of participants for this webinar series. Um, so maybe we can start so that you can. Okay, to start with the basic life support. Okay, for this session, I will be presenting to you the standard BLS because before the pandemic, we are applying these standards. But later on, we will give some guidelines on performing basic life support for suspected and positive COVID-19. Um, so let's start. Okay, for the disclaimer, this BLS webinar series is solely produced by Systems Plus College Foundation's College of Nursing, and this webinar series is based on American Heart Association Basic Life Support Guidelines, and also this does not warrant or assume any legal liability or responsibility for the accuracy and completeness or usefulness of any information process disclosed. So, what is basic life support? So, basic life support or BLS is generally refers to the type of care that first responders, healthcare providers, and public safety professionals provide to anyone who is experiencing serious or life-threatening conditions. skills in relieving airway obstructions in patients of every age. So, what is cardiac arrest? So, cardiac arrest is the abrupt loss of heart function in a person who may or may not have been diagnosed with heart disease. So, it can come on suddenly or in the wake of other symptoms. And cardiac arrest is often fatal if appropriate steps aren't taken immediately. So, I have here, this is from the Philippine in 2020, which only shows that ischemic heart disease virus, which both not identified and identified is not the leading cause. Maybe it is much better. And of course, the transfer of the victim or the client to the nearest early advanced care or hospital. So these are the steps in basic life support. So of course, approach safety, and then you check for the response, and then shout for help, especially if you are only the one at the scene. And then if there is no breathing present, so we open airway. Later on, we will be showing to you the procedure, and then you check for breathing, and then you apply initiate 30 chest compressions and 2 rescue breaths, which is this is the standard before the COVID-19 pandemic. So for the first rescuer who arrives at the site of a potential cardiac arrest victim should quickly perform the following steps. So if ever you are in that scene, if ever a loved one of yours or a friend fainted without any reason, so you should verify the scene first if it is safe to you, and if it is safe for the people around you, and then because you do not want to become a victim yourself. So even though if you wanted to help, you should always observe or reassess if the scene is safe for you. So the step 2 is you check for responsiveness. So you can either tap the victim's shoulder and shout, "Are you okay?" Or you can if the patient is Filipino, you can ask, "Hey, okay ka lang ba?" So you can ask that in your language, whether kung saan kayo dito sa Philippines. So step 3, if the victim is not responsive, so it is better to shout for nearby help. So because it is better to have somebody with you, so that somebody can call an ambulance, somebody can call the hotline. Okay. But if ever you are the only one in that scene and your cell phone is with you, you can dial in 911, and then you can put your cell phone on speaker mode while doing the procedure. And then if ever you are not a trained BLS or a trained individual, if the 911 can instruct you to what to do, so it is better to have a cell phone with you, and then you put it on speaker. So number four, you activate the emergency response systems as appropriate in your setting. In our setting, we can dial in 911. In other countries, they also have this emergency numbers. So it would depend on your work situation. You can call on your emergency number from your phone. No, you can also mobilize the code team. So if you are in the hospital setting, so or you can notify the advanced life support. So for the step five, if you are get it. So these are the foundational facts in emergency response systems. So it is very important that you activate the emergency response system, which may vary depending on your setting or local protocol. So examples includes that the hospital. So if you're in the hospital, activating a specific hospital code, or the medical emergency team or rapid response team. So in a pre-hospital, so activating EMS, paramedics, medic units, or advanced life support, or calling for backup. And if you are in your workplace or facility, calling your local emergency number or activating specific workplace emergency response protocols. So the next step would be the assessment of the victim if the victim has normal breathing and if the victim has pulse. So this will help you determine the next appropriate actions. So just to minimize the delay in starting your CPR, you may assess breathing at the same time as you check the pulse. So because it's very crucial, this is the very crucial time that you should be assessing much faster. So this should take not more than 10 seconds when you assess for the pulse and the breathing. So for the breathing, if you want to check the breathing, you can scan the victim chest for the rise and fall of the chest for no more than 10 seconds. And if the victim is breathing, so you better monitor the victim until additional help arrives. If the victim is not breathing or is only gasping, so this is not considered normal breathing because gasping is a sign of cardiac arrest. So ano ba tong gasping? Ito yung parang na hinahabol yung hininga niya, or it's like yung humihilik or snoring. Okay, that is a sign of cardiac arrest. So if you want to check the pulse, so to perform a pulse check in adult, you palpate the carotid pulse here, and 10 seconds, you start to begin high quality CPR, starting with chest compressions. In all scenarios, by the time of cardiac arrest is identified, the emergency response system or backup must be activated, or someone must be sent to retrieve an AED if it is available in your workplace or in your area, and the emergency equipment required. So this is an illustration on how to check for breathing and pulse at the same time. So as I mentioned a while ago, the agonal gasp, or it's like a snoring, no? Or yung hinahabol yung hininga nila. So agonal gasps are not normal breathing. So you should always remember that agony present in the first minutes of and drawing air very quickly. No, mouth may be open in the jaw, head, or weak. Some time may pass between gasps because they usually happen as a small slow rate. So the gasp may should like a snort, or yung sinabi ko sa inyo, yung snore or groan. So gasping is not nor nearest to you using two or three fingers as shown in the figure. So step two, slide these 2 to 3 fingers into the groove between the trachea and into the muscles at the side of the neck where you can feel the carotid pulse in figure 7b. So in the step three, feel for a pulse for at least 5, no more than 10 seconds. Okay, so that is the only time interval that you're allowed to feel the pulse. So it is at least 5. Next action is based on the presence or absence of normal breathing and pulse. So if the victim is breathing normally and the pulse is present, so you should first monitor the victim. So, but if the victim is not breathing normally, but a pulse is present, so provide rescue breathing. That is, you should also confirm that the emergency response system has been activated. You already called 911 or you already asked somebody to activate that. So continue rescue breathing and check pulse about every 2 minutes if the victim is not breathing. Okay, so be ready to perform high quality CPR if you do not feel the pulse. So if opioid use is suspected, so consider naloxone if available or follow your local protocols. But usually it is very essential first that you perform the CPR. So if the victim is not breathing normally or is only gasping and has no pulse, so you should immediately begin chest compressions. So begin high quality CPR. Start with chest compressions. So remove or you should loosen the clothing or covering the victim's chest so that you can locate the appropriate hand placement for compression. So this will also allow the placement of AED if it is available in your area or in your workplace or wherever you are. So AED pads can be used. So proceeding to the adult chest compression. So the importance of chest compressions. So each time you stop chest compressions, the blood flow to the heart and brain decreases. So once you resume compressions, it takes several compressions to increase the blood flow to the heart and to the brain. So back to the levels present before the interruption. Thus, the more often chest compressions are interrupted and the longer the interruptions are, the lower the blood supply to the heart and brain is. So it is very essential that you should immediately start compression if there is no pulse. So the high quality chest compression, if the victim is not breathing normally or is only gasping and has no pulse, so you should immediately begin CPR, start with chest compressions. So if you are the only one there, the single rescuer should use compression to ventilation of ratio of 30 compressions into 2 breaths when giving CPR. So that is for any age. So when you give chest compressions, it is important to compress at a rate of 100 to 120 per minute. So and also you should compress the chest at least 5 centimeters. Allow the chest to recoil or to re-expand. So completely after each compressions. Okay, allow the chest to recoil. Complete compressions. So these are some of the cautions. So first, you do not move the victim during compression. So do not move the victim while okay near you. So you can move the client and then you can place the client in the safe. place. So if you believe that you cannot perform CPR effectively in the victim's present position or location. So when help arrives, the resuscitation team, based on local protocol, may choose to continue CPR at the scene or transport the victim to an appropriate facility while continuing rescue efforts. So, what is the importance of a firm surface? So, compressions pump the blood in the heart to the rest of the body. So, to make the compressions as effective as possible, you should place the victim on a firm surface. If the surface is not firm, you can use backboard or anything that is flat or hard. You can place it at the back of the client. Okay. If the victim is in a soft surface, so such as mattress, the force used to compress the chest will simply push the body into the soft surface. So it is very important that you can either place a backboard if it is available, or you can place the client or the victim into a flat surface, because a firm surface allows compression to the chest and the heart to create blood flow. So these are the chest compression technique. The foundation of CPR is chest compression. So follow these steps to perform chest compression in an adult. So step one, you position yourself at the victim's side. And then step two, make sure that the victim is lying face up on a firm, flat surface. If the victim is lying face down, carefully roll him face up, because you cannot perform CPR if the client is facing down. So if you suspect the victim has a head injury or neck injury, try to keep the head, neck, and torso in line when rolling the victim to a face position. Okay. So step three, position your hands and body to perform chest compression. So you put the heel of one hand in the center of the victim's chest, okay, in the lower half of the breastbone and sternum, which will be shown later. Put the heel of your other hand at the top of the first hand, and straighten your arms and position your shoulders directly over your hand. So, and then step four, you give chest compressions at a rate of 100 compressions to 120 compressions per minute. So step five, you press down at least 5 centimeter or 2 inches with each compression. This requires really a hard work. So first, for each compression, make sure you push straight down on the victim's breastbone. So step six, at the end of each compression, you should make sure that you allow chest recoil or the chest to re-expand, so completely. So also, you should minimize interruptions of compressions. So later on in the video, it will be shown. So this is the placement of your hand at the center of the chest of the victim. So for the foundational facts, the chest recoil allows, so incomplete chest recoil, it reduces the filling of the heart, uh, uh, filling of the heart between compressions and reduces the blood flow created by the chest compression. So chest these chin lift maneuver if the jaw thrust does not open the airway. So if multiple rescuers are available, one rescuer can perform a jaw thrust, while another rescuer provides breaths with a bag mask device. So the third rescuer will give chest compression. Okay, I will be showing the video of the chest compressions, which is a ratio of 30 into two breaths, 30 compression to two breaths.
Hey, hey, are you okay? Hey, hey, are you okay?
Ayan, chinek niya ang
No
kanyang
pulse, no
pulse,
breathing.
breathing.
No start compression.
Okay, cyboid process na sabi ko, yung taas sa sikmura. And then imaginary nipple line, and then compression.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 3, 4, 5, 6, 7, 8, 29, and 1. One, two, three, four, five, six, seven, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 4, 5, 6, 7, 8, 9, and 2. One, two, three, four, five, six, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 6, 7, 8, 39, 3. One, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 5, 6, 7, 8, 9, and 4. One, two, three, four, five, six, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 6, 7, 8, 29, and 5. Assess for pulse.
Okay. For the head tilt and chin lift, so follow this step to perform a head tilt and chin lift. So first step, you place one hand on the victim's forehead and push with your palm to tilt the head back. And then for the step two, place the fingers of the other hand under the bony part of the lower jaw near the chin. And then you lift the jaw to bring the chin forward. So these are the things to avoid with the head tilt and chin lift. So do not press deeply in the soft tissue under the chin because this might block the airway. And then also do not close the victim's mouth completely. So it should be open. Okay, for the jaw thrust maneuver is used when the head tilt chin lift doesn't work, or if you are suspecting for any spinal or neck injury. So rescuers may perform a jaw thrust to open the airway in a victim with a head or neck injury. So if a spinal injury is suspected, the jaw thrust does not open the airway, so we will be using the head tilt and chin lift. So follow this step to perform a jaw thrust. So place one hand on each side of the victim's head. So you may rest your elbows on the surface on which the victim is lying. So place your fingers under the angles of the victim's lower jaw and lift with both hands, displacing the jaw forward. And then if the lips close, push the lower lip with your thumb to open the lips.
Jaw thrust maneuver. Place one hand on each side of the victim's head. You may rest your elbows on the surface on which the victim is lying. Place your fingers under the angles of the victim's lower jaw and lift with both hands, displacing the jaw forward. If the lips are closed, push the lower lip with your thumb to open the lips. Jaw thrust maneuver.
So that is the jaw thrust maneuver. So if there is a bystander who recognizes the emergency and is ready and willing to be and able to act, they can double or triple the survival rates if they immediately begin CPR. So if CPR is done and there is a presence of pulse and breathing, you should place the client or the victim in this recovery position, as shown in the picture. So these are some guidelines performing CPR for confirmed or suspected COVID-19 patients. Okay, so I think later on a lot of you will be asking if how to perform CPR to suspected or COVID-19 client. So while this CPR with breaths has been shown to be beneficial, when compared to compression-only CPR during the COVID-19 outbreak, it is currently recommended that no rescue breaths be performed for adult cardiac arrest, patients with confirmed or suspected COVID-19. So this is because due to the risk of disease transmission. So the following measures are recommended and may be associated with a decreased risk of transmitting the virus. So when assessing for normal breathing, we recommend that the CPR or the first aid care provider looks for breathing but does not listen or feel for the victim's breathing, as shown a while ago. So we usually feel the breathing of the client using our ears. So we are placing our head near the client's mouth so that we can feel if the client is breathing. So as this will minimize potential exposure. So we also recommend that adult victims of sudden cardiac arrest receive continuous compression, only CPR for their CPR first aid care provider until emergency personnel arrive. So compressions only, CPR saves life compared to no CPR at all. So it is very important that if you will be seeing somebody laying down, so to start compression, immediately. So the people who gave him CPR are what gave him a chance at all. So if ever you are a trained personnel who is present on that area, and you are the one who is responding to the victim's needs, so it is better to give your best and at least start compression instead of doing nothing at all. So with that, thank you very much for listening, and we will be attending the questions, which will be if you have any questions, you can address it in the chat box. So thank you very much for listening.
All right, thank you for the wonderful discussion and demonstration regarding first aid and basic life support. So before we award the certificate of appreciation to our beloved speakers, please allow me to acknowledge the presence of the following institutions. So we have a handful of participant parts of the country, and we are actually 1,300 in total, including the FB Live viewers. So in this chat room, I think we are a total of 937 as of this moment. So here are the following institutions: Colegio San Agustin, Bacolod; Virgen Milagrosa University Foundation, College of Nursing; University of St. La Salle, Bacolod; Manila Adventist Medical Center and Colleges; Far Eastern University, Manila; Our Lady of Fatima University in Valenzuela; MIAA, Chinese General Hospital College; University of St. Anthony, Negros Oriental State University; Baliwag University; President Ramon Magsaysay Technological University; Pinamalayan Doctors Hospital; City Government of Tanawan; Almora General Hospital; University of Makati; AGE Dialysis Center, delegates from Kingdom Saudi Arabia; University of Makati, Kanan National High School; La Union Center for Kidney Diseases; Wesleyan University of the Philippines; and we have the Ilocos Sur District Hospital, Dr. Jose G. Tamay Medical University, Puerto Galera MDRRMMO, Bataan Peninsula State University, Negros Oriental State University, Bay City, Medical Unit of AS Quezon Eastern University, Philippine Merchant Marine School, Kim Airmark from University of Pangasinan, Laguna College of San Pablo City, University of Perpetual Health, Dalta in Molino, Cavite, Active One Health, Naga College Foundation, Mega Drug Abuse Treatment and Rehabilitation Center, Fort Magsaysay, Palayan City, Nueva Ecija, Kanan National High School, School Division Office of Pangasinan, Antipolo St. Port Montessori School, Pan Pacific University, KSA, Muwasat Hospital, Santa Rosa Hospital Medical Center, University of Caloocan City, Lung Center of the Philippines, Davao Regional Medical Center, South US Specialist Hospital, Prime Mega Structures Incorporated, San Vicente District Hospital, Maria Estrella General Hospital, Cebu Doctors University Hospital. We have the South Imos Specialist Hospital, Northwestern University, Batangas State University, Maranatha Christian Academy, Santa Cruz, Laguna, Lipa City Colleges, Carmona Fire Station, Lorma Colleges, Pamantasan ng Kabuyao, Sulu State College, delegates from Nueva Ecija, Bulacan, Pampanga, NCR Bacolod, Cebu, Mindanao, Pagadian City, Queen Mary Health Christians Hospital Incorporated, Ward City, Medical Center, Mega Center of Diagnostic Corporation, Lyceum of the Philippines, University, Lyceum, Northwestern University, And hello po, Ma'am Flor Rubiano of BPSU and Dr. Jonathan Ocampo from Wesleyan University of the Philippines and the rest of the others. All right. So at this moment, we will have another virtual intermission number. So please pay attention to our screen. Thank you. Okay, again, thank you for attending our webinar series. In At this moment, we will now award the certificate of appreciation to our beloved speakers. Okay, citation reads, Assistance Plus College Foundation Angeles City, Philippines. The College of Nursing awards this certificate of appreciation to Professor Carmelita D. Ramos, RN, in grateful recognition and sharing her time and knowledge as resource speaker during the webinar on first aid and basic life support conducted via Zoom conference on April 30, 2021, 9 a.m. to 12 p.m. Signed by Dean Reggie A. Bautista, the Dean of the College of Nursing and the Chair of Organizing Committee of this webinar, and our Vice President for the Academic Affairs, Dr. Roy D. Dairit. The same goes with the certificate of appreciation is awarded to our second speaker, Professor Marco Ryan H. Batak, in grateful recognition in sharing his time and knowledge as a resource speaker during the webinar on first aid and basic life support conducted again via Zoom conference on April 30, 2021, 9 a.m. to 12 p.m., signed by our Dean and the Chair of the Organizing Committee, Dr. Reggie A. Bautista, and the Vice President for Academic Affairs, Dr. Roy D. Dairy. Okay, so okay, at this moment, so allow me to read some questions in here in the chat box coming from our virtual participants. Okay, so first question, how to handle CPR or first aid ngayon dahil sa pandemic? What if you don't know the person if positive sa COVID, and how can you give first aid to those persons? I think it's already discussed by Sir Marco kanina, and I think he will give some reiterations.
Okay, just to reiterate, no, kapag kasi usually lahat tayo nasa bahay ngayon, and then if somebody, halimbawa kamag-anak mo, kasama mo sa bahay na nag-collapse, no, siguro kung naman sasabihin mo na positive naman you're in a public place, no, if you really wanted to help, ang gagawin mo dyan is kumuha ka ng cloth or anything na pwede mag-cover sa kanyang mukha, including the nose and the mouth. And then, during this pandemic kasi, ang importante lang na ginagawa talaga is chest compression. Okay, even in the hospital, hindi naman sila nag-rescue breaths. Okay, and even in the hospital, if they are not using this guided ET tube, no, sa insertion, because when you're inserting the before, no, kapag nag-insert tayo ng mga pag nag-intubate tayo, sinisilip yan eh. Kaya nung first na talaga nagkaroon ng pandemic, no, marami ang mga doktor na namatay at nahawa ng COVID kasi kapag nag-intubate sila, yung mukha nila nakamalapit doon sa tao, no, hindi naman nila alam na infected pala. That is why ngayon, no, some of the hospital protocols, puro compression ang ginagawa nila. And then even nandyan ng may maglalagay ng intubation, kung hindi naman yan video guided, hindi rin nila gagawin just for their protection. So kapag naman sa household nangyari yan, at kung meron kang kasamang COVID suspect or COVID positive, the best thing that you can do is you wear your mask. If you have this face shield, magsuot ka. Kung pwede ka mag-double mask, N95, tapos basta double mask siya. Tapos yung victim, if kung magko-compress ka, it is not advisable to give rescue breaths. Okay? So ang gagawin lang natin, kung nasa bahay tayo, o nakakita tayo ng tao sa daan na suspected cardiac arrest, if you really wanted to help, i-cover ang kanyang muka, no? Especially the nose and the mouth. Tapos kayo, mag-double mask kayo, tapos mag-face shield kayo, and then you immediately start compression. Kasi ang compression talaga ang nagsisave ng buhay, hindi naman din ang rescue breaths. Kasi nga, yung the circulation of the blood going to the brain is very important. So, during this pandemic talaga, naging challenge yan sa lahat ng even the healthcare workers in the hospital. Kasi hindi mo pwedeng gawin talaga mag-rescue breaths, no? So, even nga yung pag-intubate, kung hindi sila video-guided, hindi ginagawa ng doktor yan. So, yun lang yung mapapayo ko, which is, it is your call naman if somebody, ano lang naman yan kumbaga kung mahal mo sa buhay yan at kasama mo sa bahay at syempre ikaw kailangan mo gawin ang part mo, that is the best thing that you can do. You cover the nose and the mouth, and then you wear your face shield, and then you double mask. Tapos, just start compression. There's no rescue breaths. Kaya nga sabi ko kanina, the BLS ngayon is different doon sa standard before. So, ngayon, chest compressions lang talaga ang ginagawa, no? So, ayun, I hope I answered your question.
Okay, I hope that he answered your question kasi naman po nagtanong. And then the second question is, what are the adjustments or additional precautionary measures and safety practices of the BLS health providers or workers during pandemic aside from PPE?
Okay, just diyan naman kapag halimbawa you are the school nurse or you are the occupational safety and health nurse of a particular institution, no? Aside from wearing PPE, number one kasi yung sarili mo muna ihanda mo doon sa iyong task. Number one, you should be healthy, no? Kasi kung ikaw alam mo sa sarili mo na hindi ka naman healthy, especially if you are the person na nandun, if you have comorbidity, mataas ang pressure mo, meron kang diabetes, tapos ikaw ang safety or health officer doon. So it will start always kung sino yung nakatask doon. Kung ikaw ang healthcare provider, no, dapat healthy ka, dapat of course yung personal hygiene mo maayos, yung palagi ka naghugas ng kamay, no? So tapos yung sarili mo kailangan naka-mask ka, naka-face shield ka. Aside from PPE, if you will respond to that situation, it is the same naman, no? Walang compressions, walang rescue breaths na magaganap, puro compression. And then sabi ko nga kanina, it is very important that you start the emergency activation, no? Yung kung tatawag ka ng 911 or any yung disaster risk reduction ng inyong LGU, kasi all of the LGU naman sa Philippines, they are already active dito sa mga ganito. They have this Facebook page, they have this hotline numbers na kapag tinawagan mo sila, halimbawa here in Angeles, meron kaming number ni LGU, meron kaming number ni na malapit na hospital. So kapag may nangyaring ganyan, even that the vehicle is not available, tawag kami agad naman dumarating yung mga, lalo na dyan sa LGU ng Angeles, is agad sila nagre-respond. So before that emergency response team will come, at least, no, kung if you suspect na cardiac arrest ang cause ng tao na kasama mo sa trabaho, yun nga, walang rescue breaths na magaganap. Yung PPE na standard na provide ng inyong institution, kailangan may suot. Kasi here in Systems Plus kasi, we have this COVID-19 response team, no? Hindi kami meron kaming protocols na bago ka mag-respond doon sa emergency, especially if yung COVID suspect or hindi man yan COVID, we treat everyone here is na lahat COVID suspect kasi hindi mo pwedeng lapitan basta-basta ang isang tao, tapos lalo na in emergency cases, no? So syempre ang PPE nandyan, ang yung standard PPE, so yun depende sa institution nyo, pero yung very basic niyan, kung walang PPE naman, yung basic na PPE is face shield and face mask, no? As much as possible, double mask talaga tayo ngayon. Tapos yung social distancing, kapag may nakita ka nga yung ka-work mo is na ganon, i-treat mo siya as COVID suspect kasi lahat naman, kasi dapat ngayon, lahat na nakakasama natin sa labas, sa trabaho, i-treat natin na meron silang COVID or suspect silang COVID, no? So yun lang talaga ang pwede natin gawin during this pandemic time. Kailangan lang natin mag-start ng compression immediately. At sa pagbilang kasi ng compression, ewan ko kung merong question yan mamaya, hindi na natin sinusundan yung 1,001, 1,002, no? Ngayon kasi at least 100 to 120 compressions. Sa ibang, kapag naman kasi sa hospital, iba din naman yan. Ang importante kasi, tuloy-tuloy ang ikot ng ang pump ng dugo sa katawan ng tao. Hindi na yan kailangan bilangin pa, no? Maybe tingnan natin kung may question mamaya doon sa kapag hindi ka marunong na mag CPR, for example, you're not a trained personnel, baka mamaya may mag-pop up na question. Anyway, answeran ko na yan ngayon. Halimbawa, napanood mo lang tong webinar series na to and then you're not a trained professional. And then nagkataon sa bahay ninyo, biglang nag-collapse yung lola mo. At na suspected na nagkaroon siya ng cardiac arrest, no? Hindi ka naman trained professional. So ano pwede mong gawin? So ang gagawin mo, mag-start ka ng compression as fast as possible. Kasi it is better na may gawin ka kaysa sa wala kang gawin, no? Kasi even though you are not a trained professional, if you are scared of damaging the ribs of your lola or of your mother or your father, hindi mo na iisipin na magka-crack yan kasi sa totoo lang, there is a very rare case na nagkakaroon ng rib fracture. Ano bang uunahin mo? Ipapump mo yung kanyang chest for the blood to circulate? Or iisipin mo na hindi mo alam gawin yung CPR at iisipin mo baka mag-crack ang kanyang rib? So, kumbaga, ang BLS kasi ngayon, no, hindi kasi siya dapat para lang sa mga trained, no? At least kailangan meron tayong information on how to do it. What is the location, how many pumps, gaano kalalim ang pinapump. Kasi ngayong panahon na to, wala naman tayong pwedeng makasama kundi yung mga kasama natin sa bahay. So kung meron man dito na mga hindi talaga trained professional, no? Malay mo, meron dito mga nursing student, meron lang dito na mga kung sino man yung mga audience natin dito na hindi medical professional. Ako, ang i-advise ko lang talaga sa inyo is kapag nangyari sa inyo at wag naman sana sa pamilya ninyo na mayroong suspected cardiac arrest, kailangan you start compressions immediately and then you call your local 911 or yung emergency response system ninyo.
All right. So I hope that Professor Marco answered your question. Okay. Next question is, during this pandemic, what are the things we should consider in providing first aid, especially with infected COVID-19? I think nasagot na rin ito ni Sir Marco. So let's move on with the question number 4. Is it okay to perform chest or abdominal thrust while nakaupo yung person na na-choke? If hindi po, how to perform the chest or abdominal thrust kapag sobrang tangkad po nung na-choke at mali po yung nagpe-perform ng first aid? Thank you po.
Okay, so that's for the first aid, no? Ang problem kasi if your patient is taller than you or bigger than you may not be able to reach yung kanyang front part, yung kanyang where you do the Heimlich, no? So unless like nag-collapse na yung tao dahil do sa absence ng kanyang breathing or absence ng airway or airway blockage, eventually magko-collapse yan eh. So pupunta siya sa floor. You can do yung modified abdominal thrust, yun yung sinasabi nating chest compressions, no, like the position that you do in
Okay, I think wala yata ng connection si Madam. Hello,
wala ba?
Hello, yes po, Ma'am Melay, sige po.
Okay. Is it okay now? Okay. For the modified, like what I've mentioned, no, you can do modified Heimlich maneuver or modified compression. Yun yung po nakahiga yung pasyente. If they are able to lie down, pwede mo naman yung i-modified chest thrust. No, pwede mong i-compress yon, yung lower arm mo or lower hand mo is open palm siya and then i-press, i-ano mo siya upward. No, like inverted J pa rin. Or pwede kang mag-back blow 5 back blows, and then you can encourage your patient to cough. Kasi kung conscious pa naman siya and they're able to cough, pwede naman yan, eventually lalabas yan in a natural way, yung kanyang blockage. So, yon.
Okay, next question. I hope na na-answer po ni Ma'am Melay po ang inyong concern po sa nagtanong po regarding modified abdominal thrush. Okay, so next question. Do all out-of-hospital seizures now require transport to the emergency department?
Okay. Not all seizures are transported to the emergency department. Kasi if you know, like kung may mga anak na po tayo, may mga seizure na na-handle naman natin sa bahay. No, like yung mga febrile seizures na these are parang compensation ng brain natin to reset itself. There are benign seizures na naturally nangyayari. So what we can do is you have to determine muna yung cause of the seizure. Kasi kung nagpunta po kayo sa ER, eventually itatanong po yan ng ER nurse sa inyo. Bakit siya nag-seizure? Ano ba yung nangyari bago siya nag-seizure? You have to determine the cause of the seizure and what happened prior to the seizure. And then, what you can do also is, kung halimbawa, what do you call this? Yung kanyang breathing, airway and circulation is already parang with difficulty na, then that's the time you can immediately take your patient to the emergency room. No,
Okay.
unang-una, yes po.
Opo. So pag may deterioration, tama po ba Ma'am Melay?
Yes po.
Okay po.
Kung meron na po kayong signs of deterioration, you have difficulty of airway, breathing, and circulation.
Okay, so I hope that answer po yung question po niya. Okay, next question. Kailan po ginagamit ang sequence na CAB sa ABC? Since CAB na po, kailan na nagagamit ang airway, breathing, circulation na sequence?
Actually, yung ABC na sequence is luma na yun. So, updated na is CAB. Kaya nga kanina, ay ni-reiterate ko, palagi kong sinasabi na you start compression. And to add naman doon, no, lahat kasi, the updated kasi ni American Heart, no, talagang kailangan start compression, i-treat mo yung situation as cardiac arrest, as presumed cardiac arrest. So, importante na magkaroon muna ng circulation, no? Mag-initiate ka ng chest compression, especially during this pandemic, hindi naman talaga maunang airway, no? So, kasi ka, sabi ko kanina, tatakpan mo pa yung bibig niyan eh. Ang importante kasi ngayon dito is the circulation of the blood. Kasi, alam naman natin na kapag walang circulation ng blood sa ating utak, mamamatay talaga tayo. Kaya nga, yung ABC, that is the old. So, follow talaga natin. Priority palagi ang circulation, priority palagi ang compression.
Okay, so that is actually under the guidelines of the American Heart Association 2020. Yes. So it started, I think, way back 2010 pa po ang ating CAB sequence.
Yes.
And so another question, is there any other way po ba aside from finger sweep in removing the object in the mouth? Because they think that finger sweeping will further push the object in the airway.
The object will be pushed further inside the airway if you are doing blind finger sweeping. That's why we do not do that. Never do blind finger sweeping. You have to maintain yung kanyang open airway palagi po para you have a complete vision of what you can see or where you're going to place that object, no, how you're going to place that object outside of the mouth. Ngayon, kung hindi talaga siya ma-open and there's no way you can open the mouth, you can always do 5 back blows and 5 abdominal thrusts. Those are the only alternative way in removing yung object po sa mouth kung nakasarado po yung kanyang bibig.
Okay. So another question, is there any guidelines in doing CPR with suspected confirmed COVID-19? Nasagot na ito kanina. So let's move on with the next question. For example po, there's a situation where you are in the public area and there's a vehicular accident, and when you assess the victim, he is unconscious, pulseless, with multiple fractures, including the ribs. Can we still do the CPR for immediate response, or baka it could lead to serious complications? Ano po kaya ang priority nursing actions po to revive the victim while waiting for the medical assistance?
Okay, sa vehicular accident naman, no, kung sino man, for example, no, dumaan ka doon sa scene tapos you really wanted to help, and then upon the assessment kasi na-assess mo na ang pasyente or the victim is pulseless, tapos the victim is not breathing, tapos you observe o parang nakapamo ang kanyang ribs ay fractured. Okay, so anong gagawin natin? If you really wanted to help the victim, dahil nga 'di ba, pulseless, wala siyang breathing. Sige, ilalagay na natin sa panahon ngayong pandemic. Gusto mo siyang tulungan. So automatic, sabi ko kanina, walang rescue breaths. Kahit ba damage ang ribs niyan, damage na yan eh. So ang priority palagi natin ngayon is if you really wanted to save that person, you begin chest compression. Kasi pagdating naman yan sa hospital, chest compression pa rin ang gagawin nila. So, kumbaga, it's better say na mayroon kang gawin dun sa tao, no? Especially if yung taong yun is mahal mo sa buhay, no? Siyempre, dito kasi i-disregard mo yung may mga questions na ganyan eh. Vehicular accident, na crash yung ribs, no? If you really wanted to try your luck to save the person, palagi, regardless of whatever yung fracture niyan, basta walang pulse, walang breathing, start chest compression immediately. Para ang blood, iikot. Okay? So, depende yan sa situation. Kung multiple fractures yan, marami ng bleeding, it's your call. If you are really a trained professional to do that, and if you really wanted to help the person, and if it will be protected by the Good Samaritan law, why not? So, it is still your call. But ang priority palagi dito, regardless of whatever the situation is, fracture it may be, kung sa ribs man yan, you initiate chest compression.
Okay, so what if the patient is obese? How can you save the patient from choking? So I think Ma'am Melay will reiterate on that.
Sorry. Obese is same with the pregnant individual. Same din po siya. We do chest thrust like performing the CPR. It's also same with the person. Kung if the person is bigger than you can do 5 back blows or 5 abdominal thrust. Syempre sa upper part po natin gagawin yung thrust na yon. And I'd like to add doon sa vehicular accident question, remember as first aiders or as practitioners, healthcare practitioners, susundan po natin yung 3 P. This is to preserve life, to prevent from worsening, and to promote recovery. Kaya dapat priority po natin lagi, sabi nga ni Sir Marco, regardless dun sa situation, iisipin mo palagi how you're going to preserve the life of that individual. Since nakatawag ka naman na kaagad ng 911, eventually they will arrive in few minutes. Do what you can muna to save the person.
Okay, so next question. How effective is CPR on prone position for COVID patients?
Prone position.
Prone position.
Is it prone position or supine? I think this must be a supine. No? Pero kasi it's almost the same with the effectiveness of conducting CPR among non-COVID suspected clients or patients or victims. No? So effective pa rin naman siya just to perform the right way. No? Tama ba ako, Sir Marco?
Yes, the right way, of course. So, paano mo gagawin yung chest compressions, no? So, sabi ko nga, kung ngayon talagang time ng pandemic, the best thing that you can do to help is start compression. i-reiterate ko nga ulit na kahit nga you are not a trained professional, instead of just looking at the person and then waiting for the help to come, so kahit na isang kamay lang yan, or for as long as you know the location of the chest compression, the heart, no, sa midline of the sternum, instead of doing nothing, it's better to do something. So yun yung kailangan tandaan ng mga nasa household natin, kasi it's not easy to ask for help. For example, your mother collapsed and then it is a suspected cardiac arrest. Hindi naman pupunta yung kapitbahay mo sa'yo na, sige, tutulungan ka namin, ako alam ko yan, ganyan. So hindi, it will always start at home. So it is better that kahit papano there's information dissemination na at least, no, yun nga, kesa wala kang gawin, kahit hindi mo siya alam gawin, as so importante, may ginawa ka to preserve the life of the victim.
Okay, so I think isang question na lang ang kaya nating entertain ngayon, although marami pang mga nagtatanong. So I have one interesting question here. Sabi dito, paano pag nasaksak daw sa chest? No, are you going to pull the knife or anything na nakasaksak doon, and if ever are going to conduct CPR?
Unang-una kung nasaksak yan sa chest, so never yan bubunutin dapat. So kung hindi naman yan hindrance sa inyong compression, okay? So kailangan kung anong sabi niya, doing CPR. So ibig sabihin, the patient is already pulseless and wala siyang breathing. So kung may nakasaksak dyan, huwag niyong bubunutin. Kahit ba yan sa tiyan pa yan, sa abdomen, or kahit sa pang location, lalo na sa chest, hindi yan kailangan bunutin. So kapag pulseless ang pasyente or the victim and wala siyang breathing, start compression.
Okay, thank you, Ma'am Mela and Sir Marco, again for the answering the questions and queries of our participants. Although we wanted to entertain the questions, no? However, ang time kasi natin is already consumed na. So maybe our speakers will answer your queries directly on the chat box na lang po niyan. Okay? So it's been a day full of learning and motivation. So indeed, this COVID-19 crisis presented a lot of challenges to every institution and community. To prepare the institution for a healthy and safe environment, post-COVID-19 is a journey in the making. That's why it's important for us to prepare and adjust to the new norm. Thus, the First Aid and Basic Life Support webinar has organized. So cardiac arrest, as we all know, is one of the leading causes of death in the modern world. And in this webinar, we have focused on the key points of performing first aid and basic life support. The goal of first aid is to save life, okay, to prevent injury and illness from worsening or to help speed recovery. So basic life support, on the other hand, includes recognition of signs of sudden cardiac arrest, heart attack, stroke, and foreign body airway obstruction, and the performance of cardiopulmonary resuscitation. So we hope we have equipped you with the basic knowledge and skills to appropriately treat with confidence unpredictable real-life situations. And we would like to reiterate that this webinar is not a substitute for hands-on first aid training by an accredited and authorized first aid training and BLS provider. If you suspect serious illness or injury, you should always seek medical advice from your doctor or other healthcare professionals, and saving life is the key. So we are in this together and we will get through this together. With that, let us give our virtual clap. Okay, virtual clap po to our dynamic speakers. Ayan, so waiting po tayo sa mga virtual clap. Okay, so just like this one. Ayan. Okay, so before we finish, let us watch this video that served as a tribute to our frontliners. Again, maraming salamat po sa inyong mga sakripisyo para sa bayan.
Thank you po.
para sa kap.
Ayan, ikaw pala. Ikaw na nga ang matagal ko nang hinihintay. Ang tanging larawan mo na lamang ba ang tanging hawak-hawak ko? At kahit anong gawin, limutin ka, hindi malis sa isip ko. Kasi di ko na matiis, love. Dahan-dahan kitang namimiss, love. Ilang beses man nilang aliwin, ikaw at ikaw pa rin ang gusto kong kinikis, love. I don't know what to do, or even I'm gonna say. Cause every time na narin ka, ako'y napapraning. Di na makagalaw sa kinatagayuan. Sa iyong ngiti, ako'y nahuhumaling. At sa tuwing ikaw ay lalapit, ang mundo ko'y tumitigil. Huwag mo sanang iisipin na papagod na ko. Di ako apurado, pero sa'yo ano ba? Gusto ko lang naman makasigurado. Kapag nakikita ka, ako ay napapraning. Bawat kiling mo na pang pag-gising, hindi mapipigilan na sa'yo'y mapatingin. Manda Rhyme Music Entertainment. Highland, lakas ng iyong dating. Kapag nakikita ka, ako ay napapraning. Bawat kiling mo na pang pag-gising, hindi mapipigilan na sa'yo'y mapatingin. Highland, lakas ng iyong dating. Kapag nakikita ka, ako ay napapraning. Bawat kiling mo na pang pag-gising, hindi mapipigilan na sa'yo'y mapatingin. Ako ay tinamaan sa natatangi mong ganda. Bawat galaw ng iyong balakang ay napapatayo mo ang lanta. Kung halaman sa katunayan, madalas nakatitig sa iyong larawan. Ang dami naman yung iba, pero ewan ko ba ikaw ang hinahangaan. Di mo na kailangan ng crown ni Catriona, at maging neneng di pa ang iyong katawan. Kahit tingin nila sa'yo ay iba na, sa'kin ikaw pa rin ang number one. Highland, lakas ng iyong dating. Kapag nakikita ka, ako ay napapraning. Bawat kiling mo na pang pag-gising, hindi mapipigilan na sa'yo'y mapatingin. Highland, lakas ng iyong dating. Kapag nakikita ka, ako ay napapraning. Bawat kiling mo na pang pag-gising, hindi mapipigilan na sa'yo'y mapatingin. Umaga, tanghali ako ng gabi, sipi ko lagi ang nasa tabi. Kapag may bagong upload ng video, teka ora mismo din ang mapakali. Diretso tindahan, te pwede pa-load, para ma-share ko at mapanood. Maubos man ang giga 50, okay lang at least hindi naubos sa board. Di man makapag-ML, sa'kin ay ayos lang. Makita ko lang kay TikTok mo, sa'kin ay ayos yon. Kaya Ling, sana ako'y pansinin. Huwag mo nang sayawin ang tala, dun di naman kita dadalhin.